We have obviously faculty, and we have what we call clinical faculty, who are the clinicians who actually work with different populations. So we range from pediatric swallowing to language, to literacy, to autism, and then we can go into the head and neck cancer, into voice disorders, fluency, both child and adult, and of course, the adult neurogenic population. The ALS population uses a sophisticated technology in their what we call an augmentative device. So they typically use a device that is controlled by their ocular motor muscle. And they can do complex thoughts, complex messages through this device that has hopefully their voice recorded. Or actually, just as a caveat, they can actually record a family member's voice if they've gotten too far down the prognosis. So somebody that has a similar dialect or a similar intonation as them, it's a decision that's made by the patient and their family. But it's not just a cognitive decision, it's an emotional decision as well. Because when you're making this decision to bank your voice, if you will, you're considering the fact that you might not have your voice one day. One reason I came to LSU, versus working in a hospital and where I've always historically been, is to inspire the students. It's not a job. It is a life, and you need to know it's a life. You need to know who you're treating. I always tell my students, I'm like, you walk out of there and I want you to think, that person I want treating my mom, my brother, my sister, my daughter. And were you that person?